Hello, I'm Chini from MSK Marai.
Several risk factors for ACL injuries include a narrow intercondylar notch, hamstring muscle weakness, increased posterior-directed tibial plateau slope, and being female. Recent studies have suggested that individuals with a narrower intercondylar notch width are at a higher risk of ACL injuries, although there's some debate in the literature. A particularly narrow intercondylar notch on MRI images can indicate a higher risk for ACL injuries. The notch width index is calculated by dividing the notch width by the bicondylar width at the level of the popliteal groove. It has been proposed that NWI values below 0.20 for males and below 0.18 for females should indicate a heightened risk for ACL injuries. This ratio helps in assessing the risk of ACL injuries. For instance, a patient with an exceptionally narrow notch might be at a higher risk, an important consideration for surgical planning and postoperative care. This patient also has an intercondylar notch width that is exceptionally narrow compared to normal. Given this constrained space for the ACL and PCL, one might speculate a higher likelihood of an ACL tear. Moreover, such patients also have a higher possibility of graft tear after ACL reconstruction. This patient had an ACL tear, and on the coronal image, the normal ACL is not visible. ACL reconstruction was performed, but the ACL graft ruptured again. Thank you for watching this video. If you found it helpful, please hit the like button.